Good morning, everybody. It is fantastic to see you all here on a really miserable, horrible morning. So thank you very much for coming. And if you don't mind, I'd like to start off with a photograph. So I know it's early morning and I know it's damp outside, but I want a big hurrah from you all. You ready? This will be for Twitter. 1, 2, 3, hurrah! Oh dear, come on. Come on, bit of enthusiasm in the room. Are you ready? 1, 2, 3, hooray! Much better. Thank you very much. So it is a very great pleasure for me to be here today. And I was just saying to my colleague, Philip Crowley, that we can't believe it's the 4th Natural Sepsis Summit. I don't know where the time has gone, but here we are. It's the 4th one. So it is a great pleasure for me to be here, not just to open the conference and to introduce the Minister, but it also gives me an opportunity to thank each and every one of you for the fantastic work that you've been doing and your dedication to tackling sepsis. So we have representatives here from nursing, from medicine, from health and social care professionals, from management, individuals from across the hospital groups and the community healthcare organisations. We have patients, we have carers, we have advocates. So we are people who are united in a common vision for tackling sepsis. And make no mistake about it, your work is extremely important. And today we're going to share stories of how sepsis affects lives and how your work is making a difference. And you're going to hear from Niamh and from Sarah. But also, my family have been affected by sepsis. And I have a story to share. And forgive me if you've heard it before, but when my daughter was 1, she went very quickly, in the matter of hours, from being a very bright, bouncy, happy toddler to being limp and lifeless in the space of a few hours. I thought she was dead. And nothing in all my years of medical training had prepared me for that. And I'll tell you, I was not a calm professional remembering all that I'd learned in my paediatric life support. I was an absolutely terrified mother who thought that her daughter was going to die. But with swift intervention by the staff in Kerry General, she made a full recovery, and I will be forever in their debt, as will all my family. And I'm very glad to tell you that Aisling is now a very stroppy teenager. I don't know where she gets the stroppiness from. It must be from her father's side of the family. But I'm very glad to say that she made a full recovery. So you understand that sepsis has no respect for age, for colour or creed, for education or status. It is a silent and deadly killer and maimer, and like all serial killers, it must be stopped. The work of the Sepsis Programme and your work brings us all together, the family of multidisciplinary healthcare professionals, patients and carers, united in a common desire to stop this killer by working together across professional and institutional boundaries, across community and hospital, towards a common aim, which is stopping sepsis. So your work matters. You matter, and you are making a difference. So I thank you. I thank you as a daughter. I thank you as a wife. I thank you as a mum. And I thank you as a colleague in healthcare. Because of you, people are surviving, and there is no better reward in our profession than knowing that we are making a difference, and you are making a difference. So together, to coin a phrase from Sarah, we are sepsis warriors. And I'm very proud to be a sepsis warrior. And it is now with great pleasure that I introduce Minister Harris, who has been a champion of the clinical programmes and the integrated care programmes, and who shares our desire for better outcomes for patients. And unlike an editorial in the Times from last week, where it suggested that there was inertia and complacency towards mediocrity, he does not accept the status quo like us, and he supports our relentless pursuit of excellence. Thank you.